Sì, la problematica della ricerca di fondi per finanziare appunto le ricerche nell'ambito della salute mentale penso che possa essere ripreso oggi, in questo momento, con questa relazione, in maniera direi estremamente precisa da un personaggio, il dottor Jean Boeckh, che è Chief Executive di una grande fondazione che proprio porta il discorso della filantropia nell'ambito della ricerca scientifica e quindi ha una esperienza e ha una capacità di visione globale che ci può permettere di capire meglio quello che è stato il problema discusso proprio recentemente. Prego, dottor Boeckh.
Hello, everybody. So I want to thank Professor Caffo for inviting me to participate in this conference. It's a very exciting initiative, and I hope that it will result in greater cooperation between Canada and Italy in mental health. Now, my family has a private foundation that focuses on mental health, and we're based in Montreal in Canada. And I don't have a professional background in mental health. In fact, my background is in economics, so my talk will be less technical than the others, but hopefully still interesting. So my talk will be divided into three parts. First of all, I will make some observations about mental health. And secondly, I'll talk a bit about the strategy that our foundation has come up with to try to have an impact. And then I'll talk about some of the initiatives that we are involved in that might be of interest to you. So this is sort of a bit of a humorous take on, it's called the medical hierarchy, and at the top are cancer and heart disease, and at the bottom is mental illness. And so this just graphically illustrates what some of the other speakers have said. And it's sad but true. And but I think one of the interesting things is when we talk to government officials or people in the healthcare system, they generally recognize this problem, that much more needs to be done in the area of mental health. But society has not yet moved to act, and so this is our challenge, is to get society to act. And I think one of the peculiar things about mental health, as shown in this slide, is this huge gap between what we know on the one hand, we know lots of effective treatments and how to help people, and the current practice, which lags way behind. And some people think there's around a 30-year gap between these. And what we see in Canada is that there are lots of wonderful programs all over the country, and they're sprinkled around everywhere, and they rarely get scaled up onto a population basis. And so this is one of the things that has really informed our strategy for our foundation. Now I want to talk about child and youth mental health. As the other speakers have said, most symptoms of mental illness appear when people are young, and this is a prime window for prevention and for early intervention. But unfortunately, because we don't have the services in place, this window of opportunity is slammed shut, and with lifelong consequences for the people that are affected, as this diagram shows. And so this is one of the reasons why we think that if you really want to have an impact on reducing the disease burden in mental health, you should focus on children and youth. So these are some of the problems that we see in the youth mental health system in Canada. And the list is long. It's confusing to access, it's disorganized, there are often long wait times, often the right services are not provided, they're not evidence-based, they're not youth-friendly, so youth often don't want to access what is available. And then there's the pediatric-adult divide in care that can really wreak havoc on a very critical point in the lives of youth. So this is our, we call our mission statement, and we have ambitious goals, and we want to be a catalyst for transformational change in mental health, and in collaboration with many other partners. And we want the changes to happen quickly, so in the next 5 to 10 years. So we've thought a lot about how we could have impact, and what we realize is that we need to try and address the problem from a number of different sides at once if we really want to have impact. And so we came up with this, there are sort of 4 different areas that we think we need to, society needs to act. So if you look at the top, one of the areas, programs and treatments. So to show society how mental health care and the system can be transformed to improve outcomes. A second area is organizing the sector. What we realize is looking around the mental health sector in Canada, and I'm sure elsewhere, is poorly organized. And we think it's very important for the sector to be able to collaborate and speak with a stronger voice. And so we have some initiatives that try to help organize the sector. Down lower, the third area is mental health care performance indicators. So this, they realize that what gets measured gets managed, and unfortunately, performance indicators for the mental health care in mental health care have been neglected relative to other areas of medicine. So we have we've initiated a major project in Canada to build these indicators and to ultimately create a report card on mental health care in Canada. And the fourth area, called public awareness and anti-stigma. And actually a lot of progress has been made in anti-stigma, but we think that the public awareness is probably a bigger issue, in the sense that if we really want to get a level playing field in the healthcare system, we have to get the attention of society and the political system. So these 4 areas, the intention is to have them work like parts of a brain, where they interact in many different ways and hopefully can create some powerful change. So I'll talk now about some of the initiatives that we're involved with. And our largest initiative is called TRAM, as Michel Maziad talked about. And TRAM stands for Transformational Research in Adolescent Mental Health. And the goal is to create a network, a national network in Canada that will be responsible for transforming mental health care for youth, roughly ages 12 to 25. And this is a joint venture between our national health research funder, called the Canadian Institutes of Health Research, and our foundation. And it's not the usual kind of research network. it's what we call a research to practice network. So the idea is to create demonstration projects with a strong evaluation component, and the idea is to set them up right from the start to be scaled up if they are successful. And the network will have a wide representation from different parts of the mental health sector, including policymakers, researchers, patients and families, and community groups. And right now there's a competitive process still going on in Canada, but by the early summer, the national network will be announced and TRAM will begin its work. Now, I'm going to talk about, under the area of treatments and programs, something that has caught our interest a lot recently. And I think if you look at the problems in the youth mental health care system, we need something like the iPhone. The iPhone has all the services, all the things that you want in one place. And so youth need all of the important services for them in one place. And it should be something that youth want to use and something that is well organized. And so we think that this actually exists somewhere in the world, and it's called Headspace, which was developed in Australia. And so Headspace is a street front clinic that is designed specifically for youth, and is a youth-friendly staff, youth-friendly decor, and has all the important services that youth could want. And I have a short video to show, and I have to apologize a little bit. It's very fast. It's meant for youth. I think so. It may be hard for you, the people for whom English is not their first language. But what I'm going to do is I'm going to try and stop it in a few places to let the translators catch up. And so I think I'll move over here.
"75% of individuals who go on to develop a psychiatric disorder have their first symptoms by age 25, and early detection and intervention can prevent the development of a psychiatric disorder, even schizophrenia, according to research by Australian psychiatrist Pat McGorry, who developed early psychosis intervention. He and his colleagues wondered then, why don't youth seek help? So they asked Australian youth, how would you design an attractive service? Well, we wanted to be able to drop in or have appointments, phone in, or use internet chat to access it, and it can't feel like a clinic. This led to the creation of the first Headspace, the National Youth Mental Health Foundation, with a quadruple emphasis on physical health, mental health, education and employment, information about substance use. The goal: we don't just want symptom reduction today, we envision a successful life for this youth at age 30. So, the front is a welcoming drop-in style center. Inside there are GPs, there are alcohol and drug counselors, there are career counselors, and there are psychologists. It's aimed for ages 12 to 25, and there are now 55 centers across Australia since 2006. Formal youth involvement has led to the creation of a National Youth Advisory Board, and this has led to a 93% satisfaction rating from users of Headspace services. The Canadian-based Boeckh Foundation aims to be a catalyst in bringing about transformational changes that significantly improve the lives of people with or at risk of mental illness. They've noticed the Headspace model and want to bring it to Canada.
hope you're able to understand a little bit of that. It's meant for youth. That's why it's so fast. Could we go back to the
Yes.
presentation? Okay. So this is just another slide on Headspace, and I think one of the beauties of Headspace, it's not just an improved way to treat youth with problems. It actually addresses some of the other issues in mental health. It can serve as an important focal point for community and political interest in mental health. It's something that people can touch and feel. It's a nationally branded network of care. And so that allows national advertising campaigns. It allows better education of the public. And so we think it's really much more than just improved care. It could really have transformational impact. So we have, in the area of programs and treatments, we have a couple of other initiatives in e-mental health and improving access to psychotherapy. I won't go into those now. So we think it's very important to have the mental health sector become more organized. So we've created 3 initiatives to try to do this. The first one is actually, it's a group of 16 private foundations in Canada that have an interest in mental health, and they've started to meet and started to even co-fund initiatives. And there are some of the largest corporations in Canada are members, as well as some private family foundations. The second initiative we call the Senior Canadian Government Officials Workshop, and we realized that senior government officials that work in mental health, they never meet. So we created a forum for them to meet and exchange ideas and to try and think about transformational change. So, and the third initiative is called the International Alliance of Mental Health Research Funders. And there was recently a meeting in London, and Professors Cafo and Maziad were there. So this is an initiative to try to improve the quality and impact of mental health research funding. And as members, we have some of the largest public funders of mental health research in the world. And there are also a number of private funders as well. And there's really 3 goals. One is information sharing and interaction. And the other is there's a series of studies that the Alliance is undertaking to really research in a formal way how mental health research funding can be made more effective. And there have been 2 studies done so far. The next study is called the Ecosystem Study, and it's really to map the global ecosystem of mental health research funding, to identify some of the innovations that are ongoing in some countries, and what are the future plans of the largest mental health research funders. So this is the Indicators project that has just been initiated in Canada, and there we have several partners who are helping to fund it. And so the idea is to really look at the healthcare system from the patient's perspective. So are they getting access to service? Are they getting the right treatments? And are they getting the right outcomes? And the final area, as I mentioned before, public awareness and anti-stigma. And this is an area we really haven't initiated any projects yet, but we're thinking about. And as I said earlier, I think, in Canada anyway, a great deal of progress has been made in terms of anti-stigma, but we still haven't captured the attention really of society and the political system. So this is our big goal, and we're actually going to Australia next month, and that's an area, a place where they seem to have captured the attention of society, and a lot of good things have begun, and so we're hoping to learn something from there. And now I'll just make a few concluding remarks. And I have a picture of Pirlo here. The reason is that he really embodies teamwork and leadership, and I think, you know, that's really what we need. That's the most important thing in trying to improve outcomes for patients and families. And I'll just conclude by a quote from the Australian psychiatrist Patrick McGorry, which I think captures the right spirit. And he says, "Mental health reform is a team game. Our team needs more recruits. We need a level playing field in the health sector, and we need the public and our governments to back the team." Thank you.
Grazie, thank you, Dr. Boeckh, for this very interesting presentation. We have time only for one or two very short questions or comments. I believe that Professor Capo should comment this very important presentation, because it's a proposal and a very good one that don't work.
No, credo che le due presentazioni finali di questa mattina danno senso di come ci siano delle opportunità importanti da considerare. Ad esempio, questa attenzione a trasferire le conoscenze della ricerca in progetti di intervento innovativi. I due progetti, sia quello australiano che canadese, rappresentano un percorso per noi molto importante. Dare da una parte ascolto a bambini e adolescenti attraverso dei sistemi anche sempre più legati al mondo dei ragazzi, quindi usando nuove tecnologie, cercando di cogliere anche opportunità nella comunità dei giovani di poter parlare di salute mentale, e dall'altra parte di costruire i servizi per poter in qualche modo dare risposte più adeguate, più efficaci, con trattamenti di psicoterapia efficaci, ma soprattutto con l'intervento di comunità che possa in qualche modo permetterci anche di conoscere gli outcome e quindi i risultati di questi interventi. Purtroppo devo dire il dibattito che caratterizza il nostro Paese è spesso un dibattito in cui le persone in modo autoreferenziale presentano quello che fanno. Credo che il confronto internazionale, in questo caso con due paesi in particolare, io in Canada in prima istanza, ma anche l'Australia, e devo dire che con Pat McGorry avremo un incontro qui a Modena tra qualche mese. McGorry ha costruito in Australia una rete, che poi di cui parlava anche Boeckh, di grande interesse, cioè questi centri per i giovani, fatti per i giovani, che i ragazzi frequentano con grande interesse. È un bellissimo progetto che si è diffuso in tutto il mondo. Pat McGorry nell'alleanza internazionale di cui si parla prima è un po' la persona che ha promosso questo percorso, unendo la scienza alle politiche sanitarie. Il governo australiano ha sviluppato questo in modo pieno, il governo canadese ha iniziato questo percorso. Il percorso del TRAM è di grande interesse, trasformare le conoscenze della ricerca in interventi concreti, e questo secondo me è un segnale positivo. Ma quello che diceva anche Boeckh, che ha detto anche Michel Maziad, è che c'è un investimento della comunità attraverso le fondazioni, attraverso la filantropia, con la collaborazione dello Stato. Lo Stato non è quello che governa tutti i servizi e decide dove andare, è la comunità che si esprime attraverso il pubblico e il privato sociale, e questo guardando gli interessi della comunità, e questo secondo me è un bel segnale e può essere anche utile per la nostra città.
Grazie.